I am very happy to introduce everyone to Lisa Geller, someone who I've known for many, many years now. And for full disclosure, I was her medical oncologist at the Massachusetts General Hospital for part of her journey. And I've seen her through some of the worst, but also saw her walk through the other side. And she tells quite a journey and one that isn't completed yet. So with that, welcome.
Thank you. Thank you very much.
Give us a little bit of your background so that the listeners can put some context into what we're going to talk about.
Sure. I'm 47 years old, grew up outside of Boston. I currently teach at a private boarding school in Maine. I work with teenagers every day, so that's an adventure. And interested in a lot of things. I like to read and write, and I especially like to write, cook, and spend time with friends and family. So that's a little bit about who I am.
I know your personal history as it relates to this cancer goes back quite a bit, knowing that you were diagnosed not only the one cancer that I met you for, but even before then. Do you want to go ahead and tell us about your experiences in the world of cancer?
Sure. So exactly 10 years ago, around this time, I was experiencing an itch and a cough. Thought the cough was just allergies, thought the itch was just maybe a reaction to something, maybe eczema, something like that. And eventually went to the doctor, had some blood work done, and they found some elevated white cell count. And one thing led to another. And in December of 2010, I was diagnosed with Hodgkin's lymphoma. I spent 6 to 8 months in treatment. I had a pause in there for, I had a pneumonia, some kind of infection that put me in the hospital and put my treatment on pause for a little while. I just did the traditional ABVD regimen of drugs and was in remission about 9 months later. About a year after that, I went in for my annual or every 6 month scan, and the Hodgkin lymphoma had returned. And I was then told that I had to have a stem cell transplant. Mm-hmm. So I then went through chemotherapy, stem cell transplant, and radiation. And that was a long time between treatment and recovery. I would say about a year till I started to feel like myself again. Mm-hmm. Then I went into remission again. And then about a year and a half later, was diagnosed with endometrial cancer.
And how old were you when you were diagnosed with the endometrial cancer at that point? You were early 40s?
Early 40s. Yep. I believe I was 41 or 42. I was 37 when I was diagnosed with the Hodgkin's, and I think it was about 5 years later.
I'm wondering, that whole experience with the lymphoma, how did you approach that at such a young age? Especially as you went into remission and relapse and then had to undergo treatment again.
Well, yes, I am very independent. And along with that comes being a control freak. And for me, I lost all control. I don't know how to describe it, but when you lose control of your body and you're a person that's always in control, it's a big blow to your psyche. It's something that, I have faith in medicine and I have faith in my doctors, the people who've treated me, especially you, but you're sort of giving over the deepest part of yourself to something and you don't know what's going to happen. It took its emotional toll on me, for sure.
Yeah. Some people talk about the quote end of cancer treatment and that experience of remission as celebratory, the sort of let's throw a party. I'm going to leave this all behind me and I'm going to go forward. Was that your experience when you were dealing with the lymphoma?
Yes. My sister had Hodgkin's lymphoma also. Oh. And so I saw her go through the treatment and do all of that. And then she was fine. So I just thought, okay, the same thing. I'll go through the treatment and I'll be fine 6 months later, 8 months later, and move on with my life. I've worked my whole life. I was always kind of itching to get back into work and back with my friends and, live a normal life. doing things that people my age were doing, getting married, moving up in their careers, having kids, buying houses, and all of that stopped. And so when I went into remission each time from the Hodgkin's, I thought, okay, I'm ready for this. I'm ready to start living my life again.
Now, when you were diagnosed with the uterine cancer, I remember meeting you for the first time, and I think we even had a conversation about it's not usual for young women to get this kind of endometrial cancer. And it's not usually, someone like you typically doesn't develop something like this. It's older women, presents with bleeding, but after the menopause. I'm wondering, did the lymphoma experience prepare you at all for your diagnosis of endometrial cancer?
That's a good question. I mean, it just took me by surprise. I just thought, okay, stem cell transplant, knocked that out, all set, all good to go. And it took me by surprise. And I think there were coping strategies that I had that helped with the endometrial cancer. But I think whether it was with you or my other doctors who treated me for the endometrial cancer, one of you or all of you or eventually would say, we've never seen this before. Whereas I felt like when I had the Hodgkin's, it was kind of a known quantity. People have had it before. And I always kept feeling like I'm getting this. I've never seen this before. We've never seen this before. It's growing so fast. We've never seen this before. And so all that uncertainty was a lot different because I didn't know what to expect from day to day, from appointment to appointment.
And at that point, what did you tell people about what you were going through after 2 experiences undergoing pretty intensive therapy for a blood cancer, and now you're dealing with this? Did you share that with your friends?
I did. The first 2 times I had a core group of friends, and I shared it. And I don't think I talked about it like a ton on social media the first 2 times. I was pretty quiet with it, pretty private with it. And then the difference when I was diagnosed with the endometrial was I didn't want to be quiet with it anymore. And I started to write, and I started a blog, and I found a lot of support doing that. There's the supportive community that are your friends and family, and they pass it along to other people. And I still get emails from people saying, oh, I'm in Australia and I'm experiencing the same thing you are. And so I shared a lot of myself about that. I did struggle. I think there's not a stigma is the wrong word, but there's sort of an embarrassment attached to anything that has to do with having a female cancer or a lady cancer. And so that was hard to share because a lot of people don't know what that means, what endometrial or uterine cancer means. I had a lot of like, well, what is that? It's not as basic. So that was interesting.
I'm wondering, what was the difference in terms of the support you got through social media and all your online community, and compare that with what you had in your life?
What I got through the online community was that I wasn't alone. And it was people who were experiencing similar things reached out to me. And that was good to know that I wasn't alone. And then the other thing was I'm a person who has a lot of friends, but a small group. I tend to be more on the introverted side. So I have a small group of very good friends, and then I have a lot of friends. And so this was like opening my tent up and sort of saying, okay, you people can come in and be in this with me. And I felt loved and cared for and supported, and it was really helpful.
Did you find you could be more honest in one medium versus another?
I am a person that deals with things with humor. So I always had a little snark to what I wrote. And I think that was a protective mechanism to say, okay, I'm going to share this much, but I'm not going to share all the way. I'm not going to share all of it. There's still a little piece I'm keeping to myself.
Yeah. All right. So let's talk about your experience with endometrial cancer. Why don't you tell folks what your experience was like?
Yeah. So I thought I was going to have surgery and be done with it. So when I was diagnosed, it was localized, and I had a hysterectomy and thought that was it. I was going to be fine. Again, knew somebody who was in a similar situation, same thing that happened to this woman. Again, this woman was much older, was a colleague of my mother's. and she had the hysterectomy and was fine. And then one thing led to another, and it spread, and it was kind of like, what do I do? And surgery, radiation, all those things, like what, all of a sudden it was so many moving parts, I guess. It wasn't just getting on chemo. And it was also that chemo wasn't necessarily an option for me because I had the stem cell transplant. And
I remember that even the little bit of chemotherapy your body couldn't withstand.
Right.
Because of the
Yeah. Yeah. You put me on something. Cisplatin. Yep. And I was knocked out for a couple of weeks, I think, even my counts were. And I can't tolerate that. And so everybody sort of thinks, oh, you have cancer, you get chemo, and that's how you treat it. And for me, it was sort of different things that were needed to treat me. And so she's saying it spread and we probably have to do radiation, but we're not really sure. So, go ahead and get a second opinion. And so I got my second opinion before I really got my first opinion, which was you. And I went to a doctor at another cancer center who told me, we only can do chemo. And we could do chemo and radiation, but it's a pretty aggressive tumor. And that's how we would do it. And then I saw you and you had a different approach. Endocrine therapy, approaching it by blocking hormones. I was thinking like, this is hocus pocus, right? Like, of course, chemo is going to work. That's going to be the thing. This is crazy. You're a crackpot. Like, I just was like in this, like, I didn't know what
just to do. For the readers to know, she actually never called me a crackpot.
No, I did not.
Case, but go on.
When somebody brings you an alternative to what is typical, I bristle at that. I'm very traditional. And so I started on that. And then that didn't really work. The tumors kept growing. And then we approached it with radiation. I mean, chemotherapy is miserable, but radiation, I had 50 days of radiation. The fatigue was just out of control and unbearable sometimes. And I got sick. There's this sort of fallacy that you kind of get zapped and you're fine. So I did the radiation and the tumors just kept coming back. They were very stubborn tumors.
At one point, I remember, it's one of the things that I remember the most about us working together, just trying to prepare you for this not going well at all.
Yeah.
And just saying, I referred you to our colleague in palliative care, which was so hard, just so it was so hard for me to do that for someone who's literally my age, to refer someone to palliative care.
Yeah. That was hard. I mean, that was sort of, I didn't know what it meant. Do you know what I mean? Like, I'd heard that term tossed around, but I didn't know what it meant until I kind of looked it up and thinking about it being, I thought I was just going for pain management. And I know that's part of it. I mean, throughout this.
Yeah, it was about supportive care, but you're right. Yeah. I mean, I think there was this underlying fear and concern. And I think at one point I remember telling you that, like, I'm actually very scared.
Yeah.
For you.
Yeah.
That I honestly was so afraid you weren't going to make it.
Yeah. Yeah. And I think that I think is just, I don't know. It's so hard to fathom that I was there, that I was at that point. And I was in so much pain. And I think the wonderful thing about pain is that you don't think about anything but the pain. And so I was sort of numb to what everything else meant. I don't know if that makes sense.
I think it does. And I think that's also why I think it was important for us to get that third person involved, that palliative care specialist, because every time we spoke, you were so concentrated on what else can we try.
Right.
And I really, really didn't want to be the one to say, we've done all we can.
Right.
There's nothing more to do.
Right.
And then to have that person extra to sort of help with the pain and also help to reinterpret things, I think, almost.
Yeah. It's like therapy, but not. I went for pain management and it helped more with emotion management. during this time, I wasn't working. I was on medical leave. And, I'm one of those people that my work gives me meaning. And so I had no meaning. I mean, it was like all I could do to walk my dog. It was a very sad time in my house. I was staying with my parents.
Right. Right.
Very sad.
So this loss of independence was just compounding everything else.
Yeah.
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 So we had decided that based on certain criteria that was present on your tumor, it was in the time when immune therapy was just sort of coming into focus in oncology. And you and I talked about that, and we decided, let's try it. I don't see a harm in trying something, even if it isn't approved. Tell us about, what was your recollection of our conversation regarding immunotherapy?
I had read this book. It was called something like Of Catastrophes and Miracles. And it was about this woman who had melanoma, who was basically at death's door, and she got on immunotherapy and it saved her. So I'd always kind of had that in my mind. And I just trusted you. Like, I just trusted that this was my only hope. I was ready to sort of figure out, it sounds morbid and whatever, but I was ready to sort of plan my funeral and try to get things in order for my parents, because they were going to have to pick up the pieces. And I just remember being hopeful. You'd think that having been through what I've been through, you might not have a lot of hope.
Yeah.
And I think there was always just a part of me that was like, I trusted you. I am like a firm believer that don't go on the internet. Like,
even though you're putting your story on the internet.
Even though my story's on the internet. But don't type in, don't, like, when I got Hodgkin's lymphoma, my mom every day would be like, oh, I read this about this, and I read this about this. And I'm like, I can't.
So I will tell you how I felt, but did you get a sense of whether or not it was working?
It was nerve-wracking at first because it was, every 3 weeks. And so I had my first treatment, and then I go in and 3 weeks pass and nothing happens. And I'm just kind of freaking out a little bit because I think it's not working. 3 weeks, It's not working. I think I went in for my next treatment and thought, okay, let's go in and do this again and see what happens. And then I remember going to see you and you giving me an exam and saying, it is literally melting away. And that was like, okay, this is going to work. And I don't know how long it was till I got a clear scan, but it was fairly quickly, I would think, in the world of cancer.
I think you're right. My recollection is at one point you were on such heavy doses of pain medications. And then, several months into treatment, you were done. And I remember we went to your surgeon who did an even better pelvic exam, and she saw no evidence of cancer. I know everybody involved in your cancer care actually cried a little.
Well, that makes me want to cry.
Well, it's one of the things that we hide from the people we treat, that we do get quite emotional, especially when, you think, I don't know what else to do.
Yeah.
This is the only thing I can try. So how has this whole experience sort of changed you? Both the good and bad. I know it can't be all like beds and roses and you just want to go dancing every day of your life.
No, definitely not. One of the more negative attitudes, maybe you would say I have, is I always think the other shoe is going to drop. It's too good to be true. But I think in a way that is sort of preparing to not live to a certain age. I don't think about myself at 80, or I don't think about myself when I retire.
And so you think your goals are like more immediate rather than these long-term things?
Yeah. Yeah. I've become less rigid. Like, I used to be a person that everything needs to be in its place. Everything needs to be clean and perfect. I'm not like that anymore. I think I'm much better in a crisis. When things don't go right, I don't think I freak out as much. I'm open to change. I think I'm willing to grow and learn from experiences. I think in some ways I have more of an open heart. I think my heart was pretty closed, and I'm more open to that.
Has it affected the way you engage with your students?
Yes. I think it's given me more of an ability to kind of meet them where they're at.
And so as you are living in uncertainty, right, with this sort of this fear of recurrence is probably on this low level of your everyday experience, I guess the question would be, what do you define as meaningful? What does a life worth living mean to you, for example?
I find meaning in work. I'm working with kids and working with and my colleagues, kind of knowing that I have an influence on kids in some way. So it's really being part of something bigger than yourself. That feeling that keeps me going. And I would say my family gives me meaning. I sort of hit the parent jackpot. As you know, my mother, the woman, until COVID, the woman never missed an appointment.
So how did you view this cancer experience as it related to what your family went through, what your mom was going through? I mean, did you tell her how scared you were at any point? Were you that honest with her?
Probably.
Yeah.
Probably.
That's good.
I would think so. I would think so. In some ways, you don't want them to know how scared you are. But I remember a moment where I told both my parents, really, I was in a lot of pain. I was lying in bed and the sun was sort of streaming through the window. And I can remember everything about it, how it felt, my dog lying in bed next to me, and just talking with them about it. Because it went unsaid sometimes. Those things went unsaid because they were too painful to talk about.
I just think there is this language of cancer that I think you're right, that is too painful for parents or siblings or husbands or loved ones. They don't want to admit how scary it is to the person undergoing it because they don't want to, quote, add a burden. What would you say to anyone who is either facing a new diagnosis or is living with this experience?
I think it's about people and letting people in and not dealing with it alone. I come from the suck it up family, just suck it up and deal. And it's okay to feel sorry for yourself. You got to sit in your crap and feel sorry for yourself. That's okay. To be in the situation where you have a diagnosis or you're living with a diagnosis, a positive attitude is great if you can have it, but it's okay to be negative. I was recently talking to an oncologist and I said, I'm very lucky. And he said to me, you're not lucky. You got cancer. You're lucky that you had a kind of cancer that could be treated, but let it suck. It's okay for it to suck, but you can't sit in it forever.
Yeah. I see you, and the word that comes to mind is resilient, that you just seem so much more resilient now after all of these years. And it's nice to see you again. And it's nice to hear that. Yeah. So let me just close and say thank you so much, Lisa, for joining us on this podcast and sharing your story. Hearing the experiences of others can help people cope with the challenges cancer brings and help others find inspiration. Leave a review of the podcast and subscribe today on iTunes or Spotify to hear every new episode. Thank you for listening to Your Stories, Conquering Cancer.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.